Okay, my name is Nestor Wagner. I will be teaching this Introduction to Medical Interpretation 1 course. You should all have a manual and a course syllabus. And if you are in remote locations or online, either you download it or you received it by email or by regular mail. So you all should have that material. Let me just briefly discuss what's part of this course. This is an 11-week course and specifically deals with medical matters as it applies to hospitals. That's really the emphasis of this course. Now, there are some exams out there that you can take once you complete this course. There are some exams, National Medical Interpreter exam, and so on and so forth. And I will give you some information as the quarter progresses, but we will discuss that later on. The material that we discuss here will definitely prepare you for that exam. And most important of all, our main emphasis is on interpreting in hospitals. All right. As a matter of fact, the exam, the national exam, is actually for that particular purpose. It's not a medical legal examination, but rather 100% medical. So we have 11 weeks. Each week the lectures are really divided into, for example, lecture 1 before the break, like this one. Then we take a break. And then there's lecture 1 after the break. If you are taking this online, not at the same time that we are broadcasting it, you're taking it later, you can watch lecture 1 before the break, which will last about an hour and 30 minutes. And then you can watch lecture 1 after the break, which will last approximately an hour and 20 minutes. Usually before the break it's a little bit longer, like 10-15 minutes longer than after the break. In this class we're going to, so we have 11 weeks total. Each week, of course, corresponds to a lecture, which is itself divided into before the break and after the break. And the main book that you need to have is the one that was given to you, or you downloaded, or it was sent to you. And we recommend a medical dictionary, which I will announce next week what's the title that we recommend, and a Spanish-English, English-Spanish dictionary, which I will also mention next week. Now, we will be using the book, and we're going to divide this class into different areas. We're going to divide the class into interpreting techniques. We're going to divide the second part of the class or the course will be on high register vocabulary. There will be a part on low register vocabulary. There will be a part on ethics of the medical interpreter. There will be a part on HIPAA rules, HIPAA rules, that has to do with private information, patients' private information, and so on and so forth. And Title 7, is it Title 7, which is the one that provides, that requires hospital to provide care to anybody who does not have the funds. So these are all this will come together, but it is not just a medical class per se, because you will also have to learn ethics of the interpreter, different scenarios, different things that you will be dealing with, and so on and so forth. Now, today what we will do before the break is discuss a few preliminary concepts that mainly have to do with high register medical vocabulary. And we're going to be using terms that are by definition high register terms, but they are terms that most likely you use them incorrectly. One of the first things that we need to point out is that when you interpret in the medical field, you have to what we call keep register. If somebody's using a complicated word in English, a medical term, you keep that register. And you need to know what the register is. But the medical field, unlike the legal field, gives you flexibility as a medical interpreter to sort of analyze the situation and basically make sure that there is communication with the patient. Cross-cultural issues, which is something we're going to be discussing here as well, tell us that in Latin America, people do not question when they don't understand. So it's very possible that they all say yes, yes, yes when the doctor is present. And then after that, they walked out and they wonder what was going on. So they ask you, ¿Qué pasó? So we have to put that into the equation. Of course, those of you who are going to be taking an exam, you can't really have any flexibility when you take an interpreting exam. You have to match the exact translation or interpretation of the term. But if you are working in a hospital, you have to use your judgment. And because it's a very dynamic environment, you can't really be taking too long to interpret for a patient. Everybody needs you and needs you right away. The other important thing, so we need to keep the register. Of course, if they use low register, and we will define these terms register and so on and so forth later on. If they use low register, like colloquial expressions and things like that, sometimes you can match the register in English, but sometimes you cannot. Because if somebody tells you, for example, me duele el lomo, which comes from the back, really, it's the upper back. In Latin America, we have, or in Spanish, we have names for body parts for human beings and body parts for animals. And people that have been in the farm or have been in the countryside tend to use vocabulary that really refers to animals. Me duelen las patas, I don't know, something to that effect. So when you put that into English, still feet, still legs, still back, no difference in English. So in that case, we don't have any matching. So we will be dealing with those issues throughout this course. The other thing we want to discuss is if you are working as for a hospital already and you are not an interpreter in the hospital, but rather you're working either as a nurse, a receptionist, anybody who is actually working in that department or that ward, you need to make a distinction between you acting as an employee of the hospital, as let's say a nurse, versus you acting as an interpreter. And you shouldn't mix these two. When you are acting as an interpreter, you are governed by the code of ethics. What that means is that you cannot answer questions even though you may know the answer to those questions if the doctor is present. So if you have a doctor, it's you and a patient, and the doctor is asking a question to the patient, you interpret that. But when the patient asks a question to a doctor, even if you know the answer, you cannot answer it. You have to interpret for the doctor. It's a very different situation if you, as an employee of the hospital, you are in a room with a patient just explaining something, like anything, discharge instructions or whatever, and you don't have an interpreter and you're explaining everything in Spanish. In that scenario, you're acting as an employee of your hospital. In the other scenario where somebody else from the hospital calls you to ask you to interpret for him or for her, you are acting as an interpreter. When acting as an interpreter in the hospital or anywhere, you need to follow certain rules, as I mentioned earlier, because there are some legal implications associated with your performance. You have certain rules when you are working in a hospital as either a nurse or a physician assistant, whatever, or receptionist, or whatever job you have in the hospital. You have one job duty. But when you are asked to interpret for someone who speaks Spanish, you have now a different job duty that comes with different ethics and different things. So we need to make a distinction at all times between you working as an hospital employee and communicating in Spanish directly without anybody being present there, except the patient who speaks Spanish, and you acting as an interpreter for a doctor or someone else. All right, that's really important. Now, if you are already as an interpreter of a particular hospital, as many of you are, and I know in remote sites we have more than 50 interpreters taking this class right now. If you're an interpreter working, let's say, for Children's Hospital of Los Angeles, and you are an interpreter for that hospital, you are governed by the rules and ethics and the code of ethics of the interpreter. At no time you will act as an employee. I mean, you may be an employee anyway, but acting as an interpreter. It's different than being a receptionist who is asked to interpret for a patient. There are different degrees of interpretation in a hospital. And usually hospitals do this. They use people that are working for them who speak Spanish to interpret for what we call basic matters. And a basic matter could be somebody coming in and needs some information or filling out a form or so on and so forth. But whenever it's more serious, like usually more serious means that the doctor is discussing something with the patient or family members, then they do use a professional interpreter. And the difference between an interpreter who is professional or who has only that job title versus an employee of the hospital who acts an interpreter from time to time is that the training is very different. This program tends to bring you, if you are an employee of a hospital, bring you up to the level of a professional interpreter. And it also explains the professional interpreter what are the limitations of those individuals who are working for the hospital, who are not interpreters, but sometimes they are asked to do so. Sometimes they are asked to translate forms and things like that. And that's also another issue that we're going to be discussing in this class. Well, let me just give you my email address in case you have any questions. My name, of course, I already mentioned, that is Nestor Wagner. My email address is scsiter@ix.netcom.com. That's one email. I have another email which is wagner@interpreting.com. If you're in a remote location or taking this course online, you can reach me at 800-625-6222. Leave a message and I'll get back to you. You can always send me questions and I will reply within 48 to 72 hours. That's the rule. And if I did not reply within that period of time, please send the email again. Most likely I did not receive the email. Now, when we talk about interpreting in general, we were discussing earlier, we talked a little bit about a concept of register. And register means you really have three different levels. You have what we call low, general, and high register. And the low register is anything that has to do with foul language, bad words, or colloquialisms. And what that means by colloquialisms and bad words is, for example, me alivié. That's a colloquialism, right? En lugar de decir di a luz, for example. But this is a colloquialism, and colloquialisms, of course, are always dependent on the country where they come from. A colloquialism, it means that it's a word that is understood in a given region in a country or in the whole country, but not in any other country. And that's important for us because we deal with patients that generally use a lot of colloquialisms. So that's an important thing that we're going to be learning here. So this is part of this course. So we're going to put an X indicating that we're going to be discussing this throughout this quarter and next quarter. General is just the general vocabulary, like table, chair, and things of that sort. This is the vocabulary that you probably use on a daily basis. We will also discuss it. I'm going to put a smaller X, but not as much because most of these things you already know. But sometimes you may not know some of those things. And if you don't, you just simply ask me. And high register is where we So this is basically generalist daily vocabulary. High register now is specifically medical terminology. And we will certainly discuss that as well. The rule clearly states in an interpreting exam, and we're going to make this distinction at all times, interpreting exam versus working in a hospital or in a clinic or a doctor's office. The rule says that whenever you work in, whenever you take an interpreting exam, you must keep the register. Just to give you a brief discussion of, or example of that. If you are, for example, if you hear the word cuate, then in English that will be buddy or pal. I know cuate means friend, but you can say, you have to use the terminology that matches the register. It really means friend, but the register, obviously, to match the register, you need to use a term that sounds similar to, or has the same register as the original. So for cuate, you'll say buddy or pal. Now, if you in the interpreting exam say friend, there will be a deduction associated with it. Now, sometimes, now, in working for hospitals or clinics or doctors, if you don't keep the register, it is not a big deal. All right? What's a big deal when you work in a hospital or you're actually doing the job is communication. It's very different than court interpreting. This class is very different because there is, this type of job lacks the formality that exists in court interpreting. So in this case, all I want when we do practices here is for you to convey the message. Now, obviously, if you can keep the register, it'll be better. You'll have a better chance of passing any medical interpreting exam. But if you don't, it is fine anyhow, provided that the message is appropriate. And when dealing with message, we need to be very careful because you need to know where the person comes from. It is really a good, it's an asset for you as an interpreter to know where the patient comes from. Or at least you need to determine that within a couple of minutes or so. Because many times they may use a word that in a given country it is considered to be a colloquialism and it has one particular translation, whereas in another country it could be considered to be a general vocabulary. For example, the word lana. In Mexico could be dough, meaning money, mula. But in other countries, it could mean wool. So a word such as lana has two basic interpretations. They are all dependent on the country that the patient is coming from. Now there are situations like this also with medical issue. For example, if a woman tells you, me alivié la semana pasada, and the person comes from Mexico, it most likely be, I gave birth last week. But if the person comes from South America, maybe she got some type of relief or some type of pain. So it's a relief of pain. Aliviarse es aliviar el dolor. So you see how knowing where the person comes from makes a big difference. If somebody tells you, me alivié la semana pasada, you need to know what exactly he or she, in this case it will be she refers to. If it's a he, there's no doubt. Now, this brings up a very interesting point. Some of you will be in hospitals doing what we call telephonic interpretation. I know there are some hospitals in Nevada, there are some hospitals in Utah at this time that are actually getting some of the interpreters, and every day of the 5 days they work, one day they stay in a room where they only answer phone calls from different doctors and people from the reception and all that stuff. When you do telephonic interpretation, you cannot see the patient, and the visual aspect is important, because if the patient says, me voy a aliviar en 2 semanas, and you can see the patient and it is a woman who is about to give birth, then that gives you enough information to process the interpretation, but over the telephone you won't see it. And so that's another area that we will be discussing in this program, so that those of you that are asked to do this over the phone then you have some idea into what needs to be done. Any questions on anything before we begin? We're going to begin now and look at what we call some preliminary concepts. Let's see if I can go back here. There you go. This is what we're going to look at today. There are two ways that you can transfer something from one language into the other. And before we even begin with specific vocabulary issues, it's important that we know the distinction between interpreting and translating. And some of you do know that, some do not. Translating is in written form. Interpreting is verbal. So when you translate, when they give you a document and they ask you to put it in the opposite language, they are asking you to translate it. If you are working in a hospital and you're asked to act as an interpreter or a translator, it is always preferable that you act as an interpreter, not as a translator. Translators require more formal education in the language that you're translating into. You need to know where the accents go and all that. Interpreters require less formal education, but more communication. So there are two ways that you transfer a term. You transfer a term so that it makes sense in the opposite language, or you transfer a term or an expression based on the individual elements of that expression. If the expression is he has, or he went to see Dr. Rodriguez, do you interpret this as you look at he and interpret he, went and interpret went, Dr. Rodriguez, and do that? Or do you just understand the concept and put it in Spanish in a way that makes sense in Spanish? Well, the normalization that we're talking about here refers precisely to that. Hearing a sentence and putting that sentence in the opposite language, let's say the sentence is in English, saying it in Spanish so that it makes sense. Then you have what we call a normalized translation. It's a way of saying it sounds more normal in the opposite language. It is also known as localization. And there is a whole whole business on localization of medical translations. Because if you get a manual, for example, that is published in the United States, like Kaiser has a manual, a handbook, that it is actually published by HealthWise in Idaho, I believe in Boise, Idaho, somewhere in there. If you get that manual, it is not only for Kaiser. I mean, they do it for Kaiser, but they do that for many other hospitals. Well, they do that type of, they provide that type of services for other hospitals, let's say in Latin America. Now, if you want to get that manual and give it to somebody in Mexico, it's going to have a different localization than if you send that manual to Venezuela. Doesn't mean that they speak different Spanish, no. But there are certain idiomatic things, colloquialisms, certain expressions that they use it in a certain way that they don't necessarily use it in Venezuela. So that's what localization means. When you hear something in English and you put that into Spanish, you automatically localize, but you localize to the country that you're more familiar with. If you grew up here and you learned Spanish from your family and your family members are from El Salvador, you will localize to the type of vocabulary used in El Salvador. That's common sense. So when you translate something, it's important that you know where that is going to go. Now, the good news is that, and this is a different area, this is a different business that has to do with translation of medical material, and you will look that up in, let's say, internet on basically type localization of medical material, translation and localization, and you get tons of referrals. But not everybody can localize properly. With this class, you will learn how to localize, because this is our main concern, or one of the main concerns when you translate. So localization is important. Now, the truth of the matter is that most of the things that you translate, I'm talking about written translation here in the U.S., remain in the United States. And when they stay here in the United States, if you are, let's say you are in the let's say, for example, that you're asked to translate just a simple form so that anybody who speaks Spanish will be able to read it and fill it out. Okay. We have a really difficult task here because our audience, the group that we're going to be doing this for, is unknown. People that are come to your hospital and need an interpreter, you could get one day somebody from Guatemala, another one from Mexico, the next one it could be from Chile, the next one could be from Colombia. So the group, this is the group here on the screen. You can see the group of people that speak Spanish. When we say speak Spanish, is really made up of different type of nationalities and different type of education and different type of experiences. And you have a document that is in English, and they ask you to put this document available, translated so that it's available to this group of people, and you have a real problem because you don't know who's going to be reading it. So in the US, instead of localizing, we do localize, of course, but we always localize to general register. What does that mean? Remember high, general, and low. We try to hit the general one because that's where the general register is shared by all countries where Spanish is spoken. But low register is not. So you need to make sure that if you have a background and you learn Spanish here in a family that, let's say, your family came from Mexico or you came from Mexico, that when you transfer something into Spanish, don't use the slang that may be used in Mexico for that term, but rather the general term. So instead of ¿cuándo fue la última vez que se alivió?, it's better if you say ¿cuándo fue la última vez que dio a luz? This is important for those of you translating in hospitals because we don't know the target audience. We don't know who they are. Now, when you interpret, on the other hand, you will be able to determine where the person comes from, maybe after a couple of minutes or so, or sometimes you do know. If you do know that the person comes from Mexico and they say, when did you give birth? It's a lady, when did you give birth? What was the last time you gave birth? You can simply say, ¿cuándo fue la última vez que se alivió? Nothing wrong with it. But you use your judgment and you localize to the nationality of that individual. But a translation, again, you don't have target. It's an undefined target audience. So in the U.S., the customary approach is when you translate documents in a hospital setting, you translate them so that you don't use colloquialisms and you don't use high register vocabulary, but rather make an effort to make it general. Why you don't use high register vocabulary? Most likely the term will not, the original form will not have high register there. But the reason why you do translate to, if there is a high register vocabulary, you translate to a general one because the main purpose of a form is for the patient to understand it. And because you are translating it, instead of using a very complicated word, you can use another word that's a synonym, but it is more in the general register. So register is a very important concept. And it becomes more important when in translation. It's really important in both parts, right? Translation or interpretation. We're always shooting for general register in translation and also try to use that for interpretation. So the idea of localization and linguistic transfers, let me give you an example in an idiomatic expression. I always use this example. It is raining cats and dogs. If you transfer that word for word, you will say llueve gatos y perros. I don't know, I've never seen that. That could really scare the patient. And that's what we call a linguistic transfer. I look up the word raining cats, dogs, and I put that in the opposite language. Proper way is, of course, llueve a cántaros or llueve mucho or anything to that effect. So you see how we convey the message. We're going to look so that's the definition of it. We already discussed that basically. And the question is, why do we need to do that? It improves accuracy when we normalized. And It will improve accuracy at all times. It will be idiomatically correct. It will improve the syntax, because sometimes the syntax is incorrect. If you keep the same word order, there is a big difference between rojo automóvil y automóvil rojo. Un hombre grande y un gran hombre. These are two different things. They even mean something different. Un gran hombre is not the same thing as un hombre grande. It improves communication, because when you localize, when you normalize, the person understands you better, feels more comfortable. And in the medical field, it is very important that the patient feels comfortable. Because particularly patients that speak Spanish, because if they don't feel comfortable, they are not going to tell you what's wrong with him or her. And quite often, they are not. If you are a female and it is a male patient and the issue has to do with impotence or something like that, you will never get a right version of what's going on. And these are things that we need to be aware of. You have to also pay attention to the fact that the people that are asking you to interpret for, like the doctors or sometimes nurses and things like that, people that are in, we can call them healthcare providers, usually they don't know how to use an interpreter, and they don't know the cross-cultural differences. They perceive everything based on what they know, and what they know is with somebody who speaks English. That's why in many hospitals, many patients will ask for doctors that speak Spanish, not because they speak Spanish only, but because they tend to understand them better. And Spanish-speaking patients need more time. The expectation is that the doctor will listen to them. In the US, that expectation is gone. It's more like very quick things, right? So it's not going to happen. So these are basically the advantages of using. You don't need to know this, but I just wanted to point this out. Now let's get into the real interesting part, the localization of certain terms in medical terms, all right? And that's what we're going to be discussing in the next 40-50 minutes. Some will be very simple, some will not. Some will be straightforward for you, some will not. The first one is always very easy. And the first one that we have is office. And the term office in the medical setting has to be translated as consultorio, no oficina. So the term office, I'm going to now use the board, office is consultorio. That's what we call this symbol here. This means transfer. Okay, that's what it means. And when I put an L below, means transfer. It's called localized transferred. What does it mean? I use a very appropriate term that will be understood in most countries. And because it's understood in most countries, it's a localized transfer into the general register. So usually that means this, L for localized, and G for general. This is a G. So if you ever see /LG, I mean the greater than and LG below, it means it's a transfer that is localized, and we attempted to use the general vocabulary. We didn't use any colloquial expression. We used the general vocabulary. So, of course, medical office, consultorio médico. Now, oficina exists, of course, but it is a different type of office. That's not where you go and see the doctor. In fact, the word consultorio comes from the word consulta. And una consulta is what you go and see the doctor for, para consultarle. Any questions on office? It's very straightforward. The second one that we have here is the word condition. And this one, we spent quite some time with this. And you know, many people like to use terms that sound similar in both languages, in Spanish and in English. So if you say, well, condition is condición, sounds like it's correct. But sometimes that's not correct, because embarrassed no es embarazada. So you need to be very careful. We will define those terms. We need to use proper Spanish. In our desire to make sure that we communicate the message, that we shouldn't really start putting terms that make no sense in Spanish or that change the meaning, because remember, we have to convey the message in an accurate manner. If it says she's embarrassed and you say ella está embarazada, I mean, it sounds similar in both languages, but that's not what it means. And as soon as we change the meaning of the original, then we are really violating our code of ethics, particularly if we know that we are doing that. So condition, most people would like to use condición, and it is never condición. In the medical field, it is never used as condición. So of course the question is, what is the translation for the word condition? Now, there are many translations for it. Let's look at some of them. One of them is enfermedad. He has arthritis condition, for example. No puede ser una condición de artritis, ni un estado de artritis, if you want to use condition for estado, ni una afección de artritis. Esto es una enfermedad, y no es cuando se refiere a la enfermedad, no es de artritis, es reumática. So here we have what we call well, it's not a sentence, it's really a unit, a linguistic unit that has two words, arthritis and condition. If you look that up in a dictionary, you see that arthritis is arthritis, and condition may give you even the word condición, particularly if you look that up in a general dictionary. So if you don't have formal training, you put this together based on the fact that, okay, well, it's una condición de artritis. And that means nothing. This is very lousy rendition. Es una enfermedad reumática. So we can define that, we can now, from now on, define that arthritis, when it's modifying something else, is reumático. Arthritis condition is the typical one. No artrítica. Yes. Arthritic, yes, thank you. Arthritic condition, que es condición reumática. Now, arthritis is arthritis, but it's used differently. For example, I have arthritis, but there's no word after arthritis, and it is arthritis with an S, so it's arthritis. But when you're acting it, it's acting as an adjective, it's modifying something else. It is reumática, so that's enfermedad reumática. So one possible translation for condition is enfermedad. What about skin condition? Well, again, if we don't know any better, we look it up in the dictionary, we see that skin is piel and condition is condición. So we'll say una condición de la piel. Enfermedad cutánea. Cutánea. Cutánea quiere decir de la piel. Now, this is the translation, of course, for any interpreting exam. In real life, most people don't know what cutánea is, the ones that you interpret for. But they do know enfermedad, so at least use enfermedad. So you can say enfermedad de la piel, there is nothing wrong with it. So you could say de la piel. And the previous one, which is enfermedad reumática, you could say una enfermedad que le produce artritis. See, you can always, what we call massage the rendition. And every time you massage the rendition, you're going to lose accuracy, because as we saw in the previous slide, when you localize, when you use the proper term, that's when you have the most accurate translation. So, for any interpreting exam, please, for skin condition, enfermedad cutánea, but for you, when you interpret in a hospital, if you feel that the person will not understand that, and that's your judgment, you can say enfermedad de la piel. There's really nothing wrong with that. Now, there's one line that you will hear a lot, doctors ask a lot to different patients, and it's a question that we want to discuss that uses the word conditions. So I'm going to move on to the next page. Is that okay with you here? I would assume it's okay with everybody else then. Usually they say, are you aware any medical condition running in your family. This is, you will see it in forms. You will hear it. This will be a question asked by doctors. So, the translation for this, of course, are you aware you have many options? Now, let me ask you this question. Are you aware, is this a term that if I use sabe, está enterado, está al tanto, would it change the meaning? Not really. So you can say sabe, o está enterado, o está al tanto. So pick whichever you like. Sabe means do you, it really means do you know. So if we really want to be very picky here, you will say, ¿está usted al tanto de alguna enfermedad hereditaria en su familia? That's the equivalent. And we can take this as a box now, and we can study it. So I'm giving you some hints as to how to study for this class. You can write down on a flashcard and write the whole sentence, not the individual words. And then you have the other one, in the back of the flashcard, you write the translation. ¿Está usted al tanto de alguna enfermedad hereditaria en su familia? And now when you hear the whole phrase, you transfer that accordingly. It doesn't say, ¿está usted al tanto de una condición médica corriendo en su familia? This running in your family tells us hereditaria en su familia. That's really that's what tells you hereditaria in a way. Now there is another one. Yes, you can use sabe usted, miss. Absolutely. You can say sabe usted, está usted enterado, está al tanto. There are terms that don't change the message, and you can pick whichever you feel comfortable with. But in this block, there are two words here, very, very important words. Medical condition running in your family. That phrase, enfermedad hereditaria en su familia, must remain the same. I don't want you to change it. That's fixed. Now, there is another one that you will hear sometimes doctors say, and let's see if you can figure this out. I'm going to write it in English, and then I'm going to ask somebody who is a volunteer to tell me what would be a good translation of the following expression. Okay, so may I move on to the next page? Okay, so here we go. This condition may present with headaches. This is a doctor telling something to the patient. This condition may present with headaches. What would that be? Anybody wants to give me give it a trial? Yes? Go ahead. The translation given here is, esta afección puede presentarse con dolores de cabeza. Okay. Afección is one translation. What about if you say esta enfermedad? You could use that too. But can you do this? You could certainly do that. Esta enfermedad puede presentarse con dolores de cabeza. And that's fine, interpreting. There's nothing wrong with it. Anybody else has a different, better translation? Yes? You use a word that I like to use in the rendition. If you do an interpretation of this, because we need to keep, we don't know the whole phrase. We are interpreting at the same time, right? If we are interpreting it simultaneous. But usually in the medical field, you don't interpret at the same time. You wait for the whole answer and then you interpret. So when you wait for the whole answer and then interpret, or when you translate, you can basically convey the message in a much better way. Now, of course, headaches is dolor de cabeza o dolores de cabeza, the technical word is cefalea. Have you ever heard that word? Okay, well, we use simple terms. El dolor de cabeza puede ser, puede ser el síntoma inicial de esta enfermedad. This is right on target. Now, obviously, we needed to wait. We can't, we start with, in English, the sentence ends with headache. In Spanish, it begins with headache. So not everybody can do this. But of course, if you say, esta enfermedad se puede presentar con dolor de cabeza, it's fine interpreting. If you translate, I would strongly suggest, or if you, in interpreting in consecutive, if you have the opportunity to do the change, it will be better to say, el dolor de cabeza puede ser el síntoma inicial de esta enfermedad. This is what sounds more like a doctor talking in Spanish. But esta condición puede presentarse con dolores de cabeza. No doctor will use that. Enfermedad is a better term. So this is another flashcard for you here. That's a good question. Why does it say inicial? Because it says may present. All right. En Spanish hay diferentes tipos de síntomas. Síntomas al principio, cuando se presenta la enfermedad, y síntomas cuando la enfermedad evoluciona. In this case, it's specifically talking at the moment when you get it for the first time. So we need to add the word inicial. That's the purpose of it. So may present is síntoma inicial. Now some of you say, wait a minute, there is no word symptom or anything like that in the original. I know, but remember, we talked about it earlier. What we like to do is sound like somebody who speaks, normalize it, localize it so that it makes sense. We don't want something that sounds Spanglish. And Spanglish doesn't mean words that sound Spanglish, but it could also be structure. Tengo un rojo automóvil. Now that's very obvious. In this case, you can't really sound Spanglish, because even if you keep the same word order and say esta enfermedad puede presentarse con dolores de cabeza, that's not Spanglish, that's also Spanish. But it is preferable that you start with the symptom, which is the headache. Put it first. El dolor de cabeza o dolores de cabeza, if you want to do that. And then you put may present, puede ser el síntoma inicial, and then this condition de esta enfermedad. So you can see one word condition, it's never condición. Now, some of you suggested we should use afección. Now, it's a higher register term. And because enfermedad is understood by everybody, afección may not. So we're going to be shooting in this class for terms that are more in the general area. I know that, obviously, instead of dolor de cabeza, if you're interpreting in a conference and a doctor is delivering speech in English to doctors who speak Spanish, then you wouldn't say dolor de cabeza. You will say, for example, la cefalea puede ser el síntoma inicial de esta enfermedad. Cefalea means dolor de cabeza. Cefalea, I'm going to write it here. Cefalea. Now, don't use it in your hospitals. Yes, ma'am. Jaqueca is a lower register, but it is also appropriate. Yes, it's not the medical term generally. It's more like the general term. Question?
I don't know, because maybe I felt like the English version was missing something. I don't know if condition
May present itself with headaches? Oh, the question is whether this is missing something. Should it be this condition may present itself with headaches? Sure, you can do that. But you don't have to. You can say this condition may present with headaches. I know there is a feeling that something is missing, but you want to put it itself? Well, put it itself. Doesn't change the interpretation. No, but this is the whole point, right? It has to sound natural to you. and I add whatever you want me to add, provided that you don't change the meaning. Because remember, you may see it in Spanish and it may go into English. So what about if somebody, now it's very unlikely here, because this is a statement usually made by doctors. So for a doctor to speak, but let's say you go to Mexico City and you're acting as an interpreter there. And if it says el dolor de cabeza puede ser, o la cefalea puede ser el síntoma inicial de esta enfermedad, you need to have a version in English that sounds that you feel comfortable with. It's the whole idea about this is that your rendition is something you feel comfortable with, because if you feel comfortable with, then in that language, whoever hears that will also feel comfortable with. Unfortunately, what happens is that here we tend to feel more comfortable with the English version, but when we go into Spanish, we don't feel that comfortable because we don't read in Spanish. And for you to feel comfortable with a language, you have to read it a lot. So what else can we talk about? What else can we say about condition? Okay, well, we can say, somebody suggested the word afección. Afección is a proper term. It's usually used for condition, of course, under very, very strict rules. If you have, and I'm going to erase this 1 second. If you have, for example, heart, or if you have kidney, or if you have liver, or if you have lung, and then you have the word condition, in this setting, you can't really say una enfermedad del corazón. You can't say una enfermedad de los riñones. You can, but there is a better term, and that is afección. And for heart, we say cardíaca. For kidney, we say afección renal, because riñones is also known as an adjective as renal in Spanish. For liver, we say afección hepática. And for lung, we say afección, you can say pulmonar or even respiratoria. So to summarize up to this point, what's the first thing that should come to your mind when you see the word condition? Enfermedad. He has a diabetic condition. Tiene la enfermedad de diabetes. Most likely that's the one that will work. But if you hear condition and right before condition you hear heart, kidney, liver, and lung, then it's preferable that you use the word afección. And can you say afección cardíaca? Can you say afección al corazón? Yes, you can say al corazón. Can you say afección a los riñones? Yes, you can do that too. Can you say afección al hígado? Sure. Can you say afección a los pulmones? Sure. But depending on how comfortable you feel with this, you may want to use cardíaca, renal, hepática, and pulmonar, because in English, the words that are acting as a noun is defined as something you can touch. So wall, heart, computer, pen, microphone, those are nouns. For example, microphone, that's a noun. But you can have a black microphone, you can have a red microphone, you can have a yellow microphone, a gray microphone. All of them are different. What modified the microphone? The color is the adjective. In English, nouns translate one way into Spanish, but adjectives translate differently. So I have a heart, tengo un corazón. But this is a heart problem, es un problema cardíaco. I have two kidneys, tengo dos riñones. But I have a kidney condition, tengo una afección renal. I have a liver, tengo un hígado. But I have a liver deficiency, tengo una deficiencia hepática. I have two lungs, tengo dos pulmones. But I have a lung condition, tengo una afección pulmonar. If you can do that, that will make you a better interpreter, but you don't have to. You can, in fact, working in hospitals or doctor's office, you can simply say, you can even say tiene una enfermedad en el corazón if you want to. We lower the register from high to lower, but still okay, because the message is still there. Tiene una enfermedad en los riñones. So you can see that the main translation for condition, it really is enfermedad more than anything else, because it tends to work at all times. We like those terms. We always, as interpreters, we always like a term that works at all times. And enfermedad is the first choice when you hear the word condition. No condición. Now, sometimes you can see that condition will not be enfermedad. I'll answer the question in a second. Because if you say, for example, he's in good health condition, you cannot say, tiene una buena enfermedad de salud. What does that mean? So in those cases when enfermedad does not work, you use estado. And that's the second possible translation. Estado. So what would be good health condition? Buen estado de salud. What would be, for example, he's in stable condition? Está en un estado estable, en un estado estacionario. Have you heard that? Stable condition. Estado estable is perfectly fine. Doctors will probably say in Latin America, estado estacionario. It means he's not going anywhere. Has been like this for the last 24 hours. It's not improving. Neither is the patient getting worse. So just to summarize, and then I'll answer that question. First thing that comes to your mind with condition is enfermedad. And the rest will take care by itself. Use whatever. If it says skin condition, enfermedad de la piel. Arthritic condition, you can say enfermedad de la artritis. You know, that's fine. There's nothing wrong with it. Now, if you want to improve your rendition for a higher register now, you say arthritic condition, enfermedad reumática. Skin condition, enfermedad cutánea. It's up to you. But if you are interpreting a hospital for a patient who doesn't have too much knowledge of medical terms, keep it simple. Keep it simple. That doesn't mean use Spanglish. It means keep it simple. All right? But if you feel that the word condition does not, enfermedad does not work for the word condition in that particular sentence, use estado and you will be correct. There's a question there, sir. You have a question? So the question is whether enfermedad can be translated as sickness or illness. Absolutely. But in English, sometimes they talk about an arthritic or skin condition. It's unlikely to say skin illness. Illness and disease is used only when the sentence ends with it. I have a disease. I have an illness. What a terrible illness. What a terrible disease. But usually when you have something that modifies condition, it tends to it modifies that disease, like skin condition, heart condition, whatever. They tend to use in English the word condition, which in Spanish still enfermedad. So illness, disease, and condition, they all mean the same in Spanish. Enfermedad. Question? ¿Cuál? Cuadro clínico. The question is, when do you use cuadro clínico? You can say medical condition. And you see the word medical, when it modifies something else, is when you use the word in Spanish clínico o clínica. Clínico generalmente. For example, medical report es un informe clínico, un informe médico. In this case, you can say estado clínico, and there is, of course, another possibility, cuadro clínico. It's really, you could use that. But if you want to know how to say in English cuadro clínico, es lo mismo que estado clínico, and it's medical condition. Now, how would you translate, let's see, next term now. See, it took us 30 minutes to talk about these two terms. What's trauma? Trauma? Maybe it's trauma, maybe it isn't. So if you think that, let's just talk about this one. All right. The word trauma could be of two types. Could have two translations. Trauma in Spanish, that is known in Spanish as una lesión psíquica. This is another thing that we have in Spanish. When we are talking about the mind, the mind has some type of disease or something, we have one translation. When we talk about the body, we have a different translation. Un trauma en Spanish es una lesión psíquica de la mente. But if it is physical, we call that traumatismo. That's una lesión física. So if you go to a hospital and it says trauma center, no puede ser un centro de traumas. Because that's not where they treat people that have psychological or mental problems. So it will be centro, it could be traumatismo, or you could also be centro de traumatología. Trauma center. Let me erase this. Trauma center. You can use centro if you want to. There's nothing wrong. In some countries, they just simply call it traumatología, period. Centro de traumatología. And we're going to look at basically the one that we deal with most of the time in hospital is traumatismos. So a trauma center is traumatología o centro de traumatología, no de traumas. And you will hear that doctors may ask questions like, for example, was that a blunt trauma? So I'm going to turn to the next page. They use blunt trauma. No es un trauma y no sé qué traducir, cómo traducirían blunt, pero contundente or something like that. No, blunt trauma is when they hit the body, the skin, the bone. So we call that traumatismo contuso. Contuso.
Blunt trauma is something that is not like chipping in. Blunt trauma is hard something that hits the surface and it can crush stuff inside, but it's not.
No, it doesn't go inside.
Yeah, that's a blunt trauma.
Right.
Yeah, so
That's why it's contuso. Because blunt has to do with the fact that it is an object that can produce at contact, at the contact. Yeah, like for example, with a baseball bat, you hit somebody. Yeah. Or you just throw something like a bowling ball. Now, contuso, de ahí viene la palabra contusión en español. When somebody hits, like let's say you're running and you hit a light pole or something, tiene una contusión because it's that hit. Doesn't mean that the pole got inside. Yeah. Yes, if you want to use, there are two. You could use force as well. You can say blunt. Let me see. If you want to know what it means, blunt force trauma. Now the translation changes, because now this is not a diagnosis, but rather is the action that produced it. See, a blunt force trauma is actually what produced that trauma, that blunt trauma. So in this case, you cannot use contuso. You will say un traumatismo por una fuerza o elemento contundente. Contundente. But blunt trauma by itself es un traumatismo contuso, no contundente. Lo que es contundente es la fuerza que se usó para ocasionar el traumatismo contuso. There you go. That's right. Yeah. For example, when the baby is being born and you pull the baby, that could be anything that, with this forceps, yes. It could be anything that has to do with, usually you get a blunt force trauma. It's like I hit you with, let's say, a baseball bat. Ese es un traumatismo por una fuerza o un elemento contundente. And what it stayed in your body is a blunt trauma, not the force portion of it. Y eso se conoce como un traumatismo contuso. Now, people don't understand what contuso means. So, do you think that traumatismo contuso is in the general register, or do you think this is more like high register? It's way high up there. So if you happen to be interpreting for a patient and the doctor asks, blunt trauma, you have a blunt trauma or something to that effect, then how would you interpret that? Anybody? Un traumatismo por un golpe. You can explain it that way. Traumatismo por un golpe, ocasionado por un golpe. Todos los traumatismos son ocasionados por golpes. If you feel that the person doesn't understand contuso, which probably will not, then you can say un traumatismo, tiene un traumatismo ocasionado por un golpe. It's important that you say the portion of golpe, because traumatismo, they will understand it. No trauma. If you say tiene un trauma, no, yo no tengo ningún trauma. ¿Cómo voy a tener un trauma? So you could, contuso, say por un golpe. Now you don't have to give details. Remember, when we explain, we lose accuracy. So there's always a penalty that we pay. But again, in the medical field, particularly working with people, it's really important that the communication is there. So it doesn't serve any purpose for you to say, el médico quiere saber si usted tuvo un traumatismo contuso. See? Yes, the patient didn't understand the question. It's better if you say, el médico quiere saber si usted tiene un traumatismo porque se dio un golpe ahí en el brazo. Now that's better. You may get an answer. Yes, sir, you have a question?
Yes, shouldn't the doctor be the one explaining it? If I'm just translating, and I use a high register, doctor's register, shouldn't the doctor be the one?
The question is, shouldn't the doctors be the one explaining? Technically, yes. That's why interpreting exams, you don't transfer. You keep the same register at all times. But doctors don't know how to use interpreters. You will be surprised. Doctors will walk in and ask you, just find out what's wrong with him. Now, this is real life. So you got to remember that when you train somebody in the medical field, you have to look at the two possibilities. One is taking an exam and becoming a medical professional interpreter, but the other one is to work. And this class emphasizes both. And I always tell you, this is for the exam, this is now for real life. But you're right. The doctors, you should say, this is an ideal case, right? You have a blunt trauma, sir. Tiene un traumatismo contuso. Now, the person says, ¿qué es contuso? What is blunt? And then the doctor explains. But you're not going to get that ¿qué es contuso from the patient. That's real life. You're not going to get that. What are you going to get? Uh-huh. And now, was the message conveyed? There is no message. So then, from a practical point of view, there is no interpretation. So the exam looks at an ideal scenario. Real life is very different. And we try to deal with both here. One, for you, once you take many people go and take the exam, pass the exam, and when they start working, they have to move to this lower register, otherwise there is no communication. But you're right. Technically, the doctor has to explain, and the patient has to ask. Neither one happens. Question?
Could you also, let's say the person is of a lower register, una lesión por un golpe?
Okay, can you say una lesión por un golpe? There is a difference between an injury and a trauma. And lesión is what corresponds to injury. But you could lower even more. Now, we have to remember, we can lower provided that we don't change meaning. Because what about if the doctor asks the following question? Did you have a trauma or an injury? What do you do there? ¿Tuvo una lesión o una... Ah, caramba. ¿Y ahora qué digo para injury? ¿Una lesión? question, Matt? Sudden. Yeah, that's why you can't use it. So the comment is that an injury is different than a trauma. Trauma is something suddenly happened, like you're driving a car and they hit you. An injury can occur suddenly, but it can occur over a period of time, or it could occur in different ways. So you cannot technically, it changes the meaning if you use it. So what about, how would you say head trauma? That's an important one to know, right? Head trauma. Head trauma. Un trauma de la cabeza. That really is bad. Well, the proper way of this is traumatismo. And of course, we have different registers. If you want to make it high, it will be traumatismo craneal. Don't use this tomorrow when you interpret for patients. Just say traumatismo en la cabeza. Two different registers. Now, you know that there is a word, and this is sort of off the subject, but it's related to it, traumatic. But do you know that traumatic could be related to something physical, or it could be something related to something psychological? We usually know it as something psychological, but you may see that they use a traumatic dislocation. Have you ever heard that? No, no quiere decir que es a dislocation que lo dejó traumado para el resto de sus días. First of all, dislocation in proper Spanish is what? Luxación. Now, would people understand luxación if you go tomorrow? So what are you going to do with dislocation? ¿Salió de su lugar? ¿Eh? ¿Cómo? Se zafó? ¿Sí? See, you can use that. Obviously, please don't use se le zafó el hombro. Don't use that in the interpreting exam because you will fail it. Luxación is the proper way for an interpreting exam. Dislocar, they may understand it as well. So a traumatic dislocation, the proper translation for this one is luxación traumática. And the traumatic, and this is physical, right? This is physical. So every time it's physical, when traumatic modifies something, you can use traumática. There's nothing wrong. But listen to this one. When traumatic refers to psychological or mental, we don't say traumático, we say traumatizante. Okay, so luxación or se les zafó. Do you have a traumatic dislocation of the shoulder? You could. Oh, but chipote is, yeah. Chichón in some countries they use for chipote, that's right. What's that in English? A bump, right? Bump in the head. Yeah, it could be that, but you don't have to explain it that much. But if they say, for example, you had a traumatic dislocation of the right shoulder, the proper translation into Spanish will be tuvo una luxación traumática del hombro derecho. High register for interpreting exams. To communicate with the patient, you're going to have to say something different. And you're going to have to say something like, se le zafó el hombro derecho y produjo muchos daños alrededor, because that's what traumatic means, that it produced a lot of, that it affected the soft tissue. So you got to be careful with this. You have to make a distinction between the exam and real life. Be careful with it. Huh? Now, I mentioned earlier that traumatic, when it refers to what do you call it? Psychological. In Spanish, we call that relativo a un trauma psíquico. We don't use traumático. We say traumatizante. I have to tell you that in most Latin American countries they use traumático. Sí, porque dice, es un trauma y me traumó, en vez de me traumatizó. Okay? So, for example, a traumatic experience es una experiencia, una situación traumatizante. Let's write an example. It's just on the side. This is not that critical. Es una experiencia traumatizante. So, what do we need to learn about trauma? Please don't use trauma. Most likely will be traumatología. That's all you need to learn. This is all important, but you need to keep that in mind. Question?
Well, it's actually just a comment. It's one area that you didn't cover, which comes up in my profession all the time, is continuous trauma.
Yes.
It's a very important term. Continuous. There's a differentiation between a specific trauma, which relates to a specific date of injury, or an injury that occurs over time, which is that. It's very common. I'm sure a lot of people.
Continuous trauma will be un traumatismo. And what would be continuous? You can use continuo, yes. What else can you say? Persistente. Sí, puede ser una fractura por un golpe, pero continuous trauma is really traumatismo persistente. It means that it has been there for a long period of time, and it's on at all times. Persistente, but you can lower the register and say continuo if you want. We'll do a couple of more words and then we'll take our break. And when we come back from the break, we're going to look at interpreting techniques and then we're going to do some practices if we have the time to do that. So usually most lectures we'll discuss terms for a while, not as long as we did right now, usually about 45 minutes or so. Then we'll discuss techniques, then we'll discuss ethics if necessary. We most likely we will do so. And then we do some practices, and then I'll give you the homework for next week. Okay, question? Oh, the question is, what's the difference between I cut my finger and I cut my finger off? One has to do whether the finger is attached or not. Right? Have you ever heard cercenar in Spanish? Okay. Me corté el dedo, me cercené el dedo. Cercenar quiere decir que se lo cortó totalmente. Cercenar. Yeah, but if you don't like to use that, cercenar. Yeah, but if you don't like to use that to cut off your finger, you can say me corté el dedo totalmente. Porque me corté el dedo means doesn't specify how much. So if I say I cut my finger, me corté el dedo. That's perfectly correct. I cut my finger off, me corté el dedo totalmente. That's the easiest way to remember. Cercenar is the technical word for it. Cercenar. Okay, so physical therapy. The next three will be a little bit easier. We might be tempted to say terapia física, but that is incorrect. We don't have that in Spanish. Fisioterapia, yes. Physical therapy is fisioterapia. And by the way, physical therapist en español no existe la palabra terapista, es terapeuta. So the translation for physical therapist is terapeuta. I don't know if he has an accent. Do you know if he has an accent? I don't think so. I tend to make mistakes with that. Sorry. Physical therapy, fisioterapia. Physical therapists, fisioterapeuta. Nada de terapia física ni de terapista físico. Oh. That is not a good thing to use. Now, what about release, which is the next word that we have to. Here is next one is release. Release could be many things, right? Usually, release is known in the hospital as the verb to discharge. Release and discharge are basically the same thing. And the translation for release is what? Dar de alta. It's funny because if you are released from the military, se le da de baja. It's really funny, eh? And of course, when you are released from jail, es poner en libertad. And then if you are released in terms of your responsibility when you sign a document is eximir de responsabilidades. Same word has so many translations. For us, in this class, all we care is dar de alta for release, which is also the translation for discharge. But let's talk a little bit about discharge, because we always tend to, dar de alta también could be, what type of alta, by the way? Because we really want to be a little bit more careful with this term for the state exam. For real life, this is fine, but usually it's alta hospitalaria. Because alta significa que lo dejan ir. Pero cuando dice alta hospitalaria, quiere decir que lo dejan salir del hospital, which is what release is. It's also used as discharge, is used for that term. In fact, you can have a discharge instructions, que son instrucciones de alta. Discharge instructions. Instrucciones de alta. Yes.
And would you also use, for instance, under instrucciones de alta hospitalaria?
The question is if you say instrucciones de alta hospitalaria. The answer is yes. For an interpreting exam, I will definitely use hospitalaria after alta. Alta hospitalaria, I don't want to separate it. For real life, you can leave alta if you want to, or alta hospitalaria. I think that patients will understand alta hospitalaria. This is not a complicated term. Now, discharge means release in some instances, but it also could be, you could also find discharge in a different context, like, for example, discharge from the ears. Y ahí no quiere decir que le dan de alta hospitalaria en los oídos. So what would be, when you talk about discharge, but now referring to some type of fluid, discharge from the ear. Supuración de los oídos. Discharge, en español, supurar quiere decir todo lo que el cuerpo humano saca en forma de líquido, de fluido. Que puede tener bacteria o no, es independiente. So, of course, and discharge also means despedir, right? If the doctor discharged the nurse, lo despidió. So be careful with discharge. Could be dar de alta hospitalaria, o dar un alta hospitalaria, generalmente. But if it refers discharge from something that the body discharges, es supurar. La herida le supura. It's very common in Spanish. Now, would people understand that? For example, let's say it's a patient and it says, and the doctor asks, did the wound discharge anything, ma'am? Then instead of saying supuró la herida, which the person will not understand, is le salió algo de la herida, right?
Yeah.
So that's the distinction that we're going to address in this class. The communication portion of it that is important without changing meaning and without adding or omitting, versus the formal terms for the interpreting exam, so that when you finish this course, this training program, you can do both. That's the whole idea. So you should really write down both of them, both terms. Yes? ¿Cómo? Le salía algo de los oídos. Le salía algún líquido, something that they understand, right? And of course, that's one of many terms, many possible terms. And I think we have one more to discuss before we take the break, and that is consent. That's easy. Consent is consentimiento. It's more of a legal term. Y generalmente se da su consentimiento para. Do you consent? No consentiona or anything like that. En español el verbo auxiliar es dar. Da su consentimiento para que lo operen. Do you consent to surgery? Okay, so this is a good time for a break. So we are going to finish now this lecture number 1 before the break, and then we'll take a break, a 20-minute break. For those of you in remote sites, you can do the same thing, actually 22 minutes. And then for those of you watching it online, you can take a break and you can watch the second part of the class either after the break or at any time during this week, okay? So let's take a 22-minute break.